Hi, everybody. It is Wednesday, August already. Can you believe it? August 3rd. I'm taping today for your viewing pleasure on Thursday, the 4th of August. I can't believe the summer's almost over. I hope you did something fun or are planning to do something fun in the next month. I'm happy to say today that we are out of outbreak testing in the health center, which is woohoo. We should celebrate. We ended up with 3 cases in the health center, which is great because we were able to stop the spread of the infection, and we had 1 resident on each hall, which is unique, but it also informs me that they were not connected, and everybody recovered just fine, and everybody is out of quarantine, and so happy about that. So we completed all of our outbreak testing yesterday, and with no additional positive cases in 14 days, we are free to roam about the building again. I will tell you, though, that the numbers in Johnson County just keep creeping up little bit by little bit. There were 442 cases this past week in Johnson County, which is roughly 63 cases a day. Not horrible, but also not great, especially with the students all gone. So I sort of throw them in as a way to sort of determine how we're really doing, and with them gone for the summer, that's a little high for me. So expect the number to keep going up, I think, over the remainder of August, and especially after they start coming back into town. In addition to that, this week I have to say the University Hospital has the most COVID cases they've had in weeks. There are 34 adult inpatients at the University Hospital with COVID and 2 pediatric patients. So we haven't been over 30 for at least 2 months. So more people are getting hospitalized. I don't know their vaccination status. As you know, here people are vaxxed and boosted, and a lot of people are double boosted. So that's great. I think that is the key to keeping symptoms mild and manageable and not needing to hospitalize anybody. So bravo to everybody for wearing their masks. I would encourage the same as I have been. Wear your masks. Wash your hands, and please invite your friends and family not to visit if they're sick. We've had 2 visitors recently in the past 10 days probably who were on campus when they developed symptoms and were in fact positive for COVID. So just let people know if they start feeling very badly or even slightly badly to test right away. That's what the people did this week, and then as soon as they tested positive, they exited the community. So if you don't live here, I'm going to ask you to leave if you're positive. I hope that makes sense to everybody, but they shouldn't stay with you in your apartment once they're sick, and they certainly shouldn't be in a guest room. So Josiah's done a great job of disinfecting spaces, as he has all along. So overall, we're doing well. We have 5 staff currently out with COVID. And a staff of 275, 280 people. That doesn't seem too bad to me right now. So COVID is still in my front window, but it is sort of becoming less and less anxious times. So that's good. If you are unwell, please let us know. We're trying to keep track of everybody and how you're doing. Monkeypox is getting a ton of press. Monkeypox, as you know, it is also a virus. It is spread by skin-to-skin contact, and what they're not saying is it's like chickenpox. So, you know, when your kids were little, you used to have chickenpox parties and invite everybody over. I'm not suggesting a monkeypox party, but I'm saying that skin-to-skin contact is how people are getting contaminated. And so I guess before you have any skin-to-skin contact with anybody, please check them out for for pustules that could rupture. Ew. I'm not really worried about monkeypox on campus. If it does come to Oak Knoll, I'll be sure to let you know, but I'm hoping we can avoid that crisis. I always want to try to throw in something fun. So besides being out of outbreak, which is super fun, we do have a concert on the 9th of August. It's Chase and Emily Garrett as part of the concert series, and they'll be here at the main campus. I don't think I have anything else. Isn't that exciting? Stay tuned for fall vaccination updates. I know that we're scheduling influenza clinics, but I believe the Pfizer and Moderna have been instructed to changed the recipe for their vaccine to include some of these variants we're dealing with. So there is probably going to be another booster in the fall for COVID, just to set your expectations. I'll let you know as soon as I know anything from public health, so we can plan and be prepared. As always, I'm super grateful for all of you and all of our staff who have done an amazing job of limiting the spread of COVID. And I will, I think, see you next week. I can't remember if I'm taping next week or Steve is, but I'll see you in 1 or 2 weeks. Let me know if you have any questions. Take care.